Walking in the morning, you never know what's gonna happen here, but regardless, you always get a good patient mix here. So many people don't realize how nutrition can affect their overall health. It's hard to understand how something you're putting into your belly is going to affect your heart. I love food, and I think that that's a requirement to be a dietitian. You have to be passionate about what you do, and the food plays such a big role in it, but you're talking to people, and it's to make a change in their lives. I am the unit-based dietitian on the cardiac floor. I specifically focus on heart failure. When patients get diagnosed with this for the first time, it can be a lot to deal with. If you don't have the proper care, it can escalate very quickly.
1 in 4 hospital discharges leads to a readmission for heart failure within the first 30 days. And often, the problem was dietary indiscretion. We developed the cardiac wellness program to keep them home with their families, to keep them out of the hospital.
Nicole has been a crucial part of that because nutrition is really one of the hardest components for our patient population.
Telling a patient that they're on a low-salt diet is never easy. It's hard to go in a room and say, you can't eat your favorite foods. If someone told me that, I'd be upset. So I always keep that in mind when I'm talking to them. Because the meals are still really flavorful, even though we don't add a lot of salt to cooking here. When patients are admitted, they're sick. A lot of times they can't breathe. They have fluid on their heart, on the lungs, and they're just not feeling well. So to be involved in wellness and to see the flip side of it, the patients are coming in because they want the help and they want the education. It's such a great feeling.
Nicole spends as much time as needed with each patient on an individual basis.
Well, I think she takes interest in what you're saying. She'll say, okay, well, if we did without this and we did without that, you could still have this. So she gives you an uplift.
Nicole impresses me because she just goes so far over and above, not just to do a job, but to show them that there is another human being here who cares about them.
And if she eats one a day, it'll last her for some time.
Yeah, maybe she'll eat 2, hopefully.
Maybe she'll start to like.
My mom has stage 4 kidney disease, and Nicole's helped us out a lot, and she's wonderful.
Right, it works.
When patients are seen in the wellness program by Nicole, their readmission rate approaches 0.
It's just great to see them share their enthusiasm because now they're embracing it.
The work I do, it's aligned with the work that Sodexo as a larger body is doing because Sodexo employs nearly 3,000 dietitians and they want to make an impact on patients and people. And the fact that that aligns with Sodexo's larger mission, it's a great feeling.
She has managed to teach patients and connect with them and keep these patients home with their families where they belong. It's an incredible thing.
You just know that she's a caring person. I feel like I know her forever. I love her.
Nicole is very understanding. She's there for you. You can call at any time of the day or night. I never saw, people that work in a hospital care as much. I feel really good. I feel like this never even happened.
I can feel confident that they're not going to come back to the hospital. I'm not going to have to see them sick in a hospital bed. And it makes me realize that I am making a difference in their lives.